Chapter 15, question 6 asks, how does an anti-inflammatory drug reduce inflammation? And we saw in question 5, inflammation is caused by prostaglandins. So these anti-inflammatory drugs are going to prevent prostaglandins from getting made. Now, the most common type of anti-inflammatory drug that you guys would prescribe as nurses or take as patients are called NSAIDs. And this is an acronym. It stands for non-steroidal anti-inflammatory drugs. Steroids have a special structure. They have a few rings in them. All steroids would have these rings like that, and then spaghetti hanging off of them. Cholesterol has an OH and like a big thing over here. But in order to be a steroid, you have to have those rings. Now, the NSAIDs do not have those rings, and so they are not steroids. So hence, non-steroidal. And they reduce inflammation, so they're anti-inflammatory, and they're drugs. So NSAIDs. The way they work, so they reduce inflammation by preventing prostaglandins from getting made. There is an enzyme. So enzymes, you can sort of imagine enzymes as Pac-Men. And the enzyme gobbles up a substrate and then spits it out as something else. There's a molecule called arachidonic acid. It's a fatty acid, a polyunsaturated fatty acid. And an enzyme will gobble that up, arachidonic acid, and then spit it out as prostaglandins. So what NSAIDs do, or non-steroidal anti-inflammatory drugs do, here I'm going to draw a non-steroidal anti-inflammatory drug in orange. So it'll make its way into the enzyme pocket. The mouth of the Pac-Man is called the active site of this enzyme, and they'll attach themselves there. Now that they're attached there, the arachidonic acid won't fit into the enzyme anymore, and the enzyme can't convert it into prostaglandins. So you don't get prostaglandins, and you don't get inflammation. So NSAIDs reduce inflammation by preventing the conversion of arachidonic acid to prostaglandins. No prostaglandins, no inflammation. An example of NSAIDs would be aspirin, ibuprofen, Aleve, Tylenol, things like that. They all act by preventing arachidonic acid from getting converted into prostaglandins.